Hello, everyone. Thanks so much for joining me today. My name is Lydia, and this is Time with Lydia, the pharmacist. A big thank you to all who have subscribed to this channel. Your support is much appreciated. This is a channel where we educate ourselves on common health problems. So if you're new to this channel, please don't hesitate to hit on the subscribe button and also on the notification bell so you don't miss anything that I upload. Today, I'm going to be spending some time with you talking about depression, and I have divided the topic into two parts. Today's chat is going to be on what depression is. We are going to be talking about some symptoms of depression, and we are going to be looking at some causes of depression. To start with, I want to spell out some key facts from the World Health Organization about depression. Depression is a common mental disorder. Globally, more than 264 million people of all ages suffer from depression. Depression is a leading cause of disability worldwide and is a major contributor to the overall global burden of disease. More women are affected by depression than men. Depression can lead to suicide. And there are effective psychological and pharmacological treatments for moderate and severe depression. So what is depression? Depression is defined as a low mood that lasts for a long time and affects your everyday life. It is more than simply feeling unhappy or fed up for a few days. We all go through periods of feeling down. But when there is a persistent feeling of sadness for weeks or months rather than days, then you might be depressed. It can cause the affected person to suffer greatly and function poorly at work, at school, and in the family. Some people think depression is trivial and not a genuine health condition. It is a real illness with real symptoms, and affects about 1 in 10 people in their lives. It impacts people of all genders and ages. It does not portray the fact that you're weak, and it is not something you can just come out of by pulling yourself together. The good news is that with the right treatment and support, most people can make a full recovery. There are different types of depression, and there are some conditions where depression may be one of the symptoms. The different types include postnatal depression, and this is the type that affects new mothers and fathers after they have had a baby. We've also got prenatal depression, and this is sometimes called antenatal depression. This occurs during pregnancy. Another one is bipolar disorder. This is also known as manic depression. People with bipolar disorder experience spells of both depressive symptoms and excessive high mood or mania, separated by periods of normal mood. Mania can include harmful behavior such as gambling, having unsafe sex, and going on a shopping spree. Another type is seasonal affective disorder. This is seasonal as it only occurs at a particular time of the year or during a particular season. Another type is chronic depression, and this is a continuous mild depression that lasts for 2 years or more. This type is also called persistent depressive disorder. Depression can often come on gradually, so it can be difficult to notice something is wrong. Many people try to cope with their symptoms without realizing they are unwell. It can sometimes take a friend or family member to suggest something is wrong. Depending on the number and severity of symptoms, a depressive episode can be categorized as mild, moderate, or severe. An individual with a mild depressive episode would have some difficulty in continuing with ordinary work and social activities, but will probably not cease to function completely. Moderate depression has a significant impact on your daily life. During a severe depressive episode, it is unlikely that the sufferer will be able to continue with social, work, or domestic activities, except to a limited extent. Symptoms of depression are categorized into psychological, physical, and social. Psychological symptoms include continuous low mood and sadness, feeling hopeless and helpless, feeling of emptiness, having low self-esteem, tearful and guilt-ridden, feeling irritable and intolerant of others, having no motivation or interest in things, finding it difficult to make decisions, and not getting any enjoyment out of life, feeling anxious and worried, having suicidal thoughts or thoughts of harming yourself. If you're feeling low, you might use self-harming behaviors to cope with difficult feelings. Although this might make you feel better in the short term, self-harm can be very dangerous and can make you feel a lot worse in the long term. When you're feeling really low and hopeless, you might find yourself thinking about suicide. Whether you're only thinking about the idea or actually considering a plan to end your life, these thoughts can feel difficult to control and very frightening. Physical symptoms of depression include speaking more slowly than usual, changes in appetite or weight, constipation, and unexplained aches and pains, feeling tired all the time, a low sex drive, and changes in menstrual cycle, difficulty sleeping or sleeping too much. And the social symptoms of depression include avoiding contact with friends and taking part in fewer social activities, neglecting your hobbies and interests, having difficulty in your home, your work, or family life, and using more tobacco, alcohol, or other drugs than usual. I want to take this time to look at grief and depression. And this is because it is always difficult to distinguish between grief and depression. They share many of the same characteristics, but there are important differences between them. Grief is an entirely natural response to a loss, whilst depression is an illness. People who are grieving find their feelings of sadness and loss come and go, but they are still able to enjoy things and look forward to the future. In contrast, people who are depressed constantly feel sad. They find it difficult to enjoy anything or be positive about the future. Now let's move on to the causes of depression. There is no single cause of depression. It can occur for a variety of reasons, and it has many different triggers. For some people, a combination of different factors may cause their depression. Some find that they become depressed without any obvious reasons. Some of the things that can cause depression include stressful events. For some people, it can take time to come to terms with stressful events such as a bereavement or a relationship breakdown, illness, redundancy, or money problems. Major life changes like changing jobs, moving house, or getting married, being physically and sexually assaulted, or being bullied. When these stressful events occur, your risk of becoming depressed is increased if you stop seeing your friends and family and try to deal with your problems on your own. Another cause is personality. You may be more vulnerable to depression if you have certain personality traits, such as low self-esteem or being overly self-critical. Also, a family history of depression can be a trigger. Although no specific genes for depression have been identified, research has shown that if someone in your family, such as a parent, a brother, or a sister, has had depression in the past, it is more likely that you also develop it. This might be from similar biological makeup Or link could be because we usually learn behavior and ways of coping from the people around us as we grow up. Giving birth can also be a cause. Some women are particularly vulnerable to depression after pregnancy. The hormonal and physical changes, as well as the added responsibility of a new life, can lead to postnatal depression. Feelings of loneliness caused by things such as becoming cut off from your family and friends can also increase your risk of depression. Some medication, alcohol, and drugs like cannabis can also cause depression. For some people, when life is getting them down, they try to cope by drinking too much alcohol or taking drugs. This can result in depression. Drugs like cannabis can help you relax, but there's evidence that it can also bring on depression, particularly in teenagers. Drowning your sorrows with a drink is also not recommended. Alcohol affects the chemistry of the brain, which increases the risk of depression. Depression can also be a side effect of a lot of different medicines. If you're feeling depressed after starting any kind of medication, check the patient information leaflet to see whether depression is a side effect, or ask your doctor or pharmacist. If you think a drug is causing your depression, you can talk to your doctor about taking an alternative, especially if you're taking the medication for a long time. Some childhood experiences like physical, sexual, or emotional abuse, neglect, the loss of someone close to you, traumatic events, an unstable family situation can all cause depression. There is good evidence to show that going through difficult experiences in your childhood can affect your self-esteem and can make you vulnerable to experiencing depression later in life. You may also have a higher risk of depression if you have a chronic or life-threatening illness, such as coronary heart disease or cancer. Head injuries are also an often under-recognized cause of depression. A severe head injury can trigger mood swings and emotional problems. In rare cases, a minor head injury can damage the pituitary gland, which is a pea-sized gland at the base of your brain that produces thyroid-stimulating hormones. This can cause a number of symptoms, such as extreme tiredness and a lack of interest in sex, which can in turn lead to depression. How is depression diagnosed? There is no physical test for depression. If you experience depressive symptoms most of the day, every day, or for more than 2 weeks, then visit your doctor. This is especially important if your symptoms of depression are not getting any better, if you have thoughts of self-harm or suicide, and if your work, your relationship with friends and family, or interests are affected by your mood. The sooner you seek help, the sooner the symptoms will start to get better. Your doctor may examine you and perform some blood or urine tests just to rule out any other conditions. They would also ask you questions to try to find out if you have depression. These are likely to be about your health, how you're feeling, and how that is affecting you mentally and physically. Telling your doctor your symptoms and the effect they are having on you will help them figure out if you have depression and how severe the condition is. It is important to be as open as possible. Once it is established that you're suffering from depression, there's various things that can be prescribed. There's non-medicinal ways of dealing with depression, and there are drugs that can be prescribed to treat depression. Please make sure you don't miss my next video because I'm going to be talking about some useful tips that can help you get rid of the symptoms of depression, as well as some drugs that can be prescribed by your doctor for the treatment of depression. I hope you have learned something today. If you have, then please give this video a thumbs up. Remember to share this information with family and friends, and leave your comments, your questions, and your suggestions in the comment section. If you haven't yet subscribed to this channel, please don't hesitate to hit on that subscribe button and also on the notification bell so you don't miss anything that I upload. Thank you once again for joining me today, and I hope to see you soon in my next video. Bye for now.